Recognizing the member for North Vancouver Seymour.
Thank you very much, Chair. So, do you want me to wait for your staff? Okay. According to the minister's mandate letter, there is no mention of child and youth mental health. It's my understanding that child and youth mental health is still under this ministry.
Minister.
Thank you, Chair, and thank the member for the question. Mental health is a priority for our government. That's why it is we have created a mental health and addictions ministry. With the minister has in her mandate letter, the member is correct, around that that ministry is responsible for early prevention and youth mental health. We are under our ministry. We continue to have responsibility for delivery, but we are working closely with the new minister and the new ministry to ensure that we have a strategy in place to ensure that there are services for the children and youth in place to make sure that kids in this province are getting the services they need. And it's right now it's community-based. The member will probably know our ministry is responsible for community-based mental health services for children and youth, and the new ministry is looking at the big system of services. But we are working together, collaborating together to ensure that those services are there for children and youth in the province.
Member.
Welcome, Chair. Thank you. And happy birthday.
Oh, thank you. Out of order.
Okay, to the minister, I just wanted to get a handle on where everything is, because obviously there is the new ministry, and right now her new ministry she's described it. The new minister has described it as a leadership role, a strategic role, but not a service delivering role. And it is my understanding that MCFD still has the child and youth mental health portion of mental health in this ministry.
Minister.
Thank you, Chair. And as the member's right, community-based child and youth mental health services are still under the purview of Ministry of Children and Family Development.
Member.
Thank you. So that's the same model that was present in the previous government then. Because I know there's been some talk, the reason why I'm asking this is about removing the child and youth mental health out of MCFD and putting it into health. So I just wanted to confirm that it's still sticking with MCFD. So according to the minister's service plan, the 2016-17 restated estimates, 80 some odd million, and then 2017 and 2018, a little bump up of 16 million to 96 million. Is that new money then from the previous budget in February, or was that already announced?
Minister.
Thank you, Mr. Chair. So the member is correct. There was new money in February 2017, 15 million for mental health services, and that's being used to hire new staff, to increase funding for the expansion of the Confident Parents Thriving Kids program, also the expansion of Family Smart, a program that I know the member is well aware of, and also it was to support the implementation of trauma-informed practice across the ministry, and expansion of the complex care intervention program, program for children and youth who are impacted by complex trauma.
Member.
Thank you, Chair, and thank you for that clarification. So that extra money then went to staffing. Does the minister know how many staff are dedicated to mental health services for MCFD?
Minister.
Thank you, Chair. Currently, we have about 500 mental health practitioners, including counselors, nurses, psychologists, psychiatrists, clinical social workers that provide community-based child and youth mental health services. And the hiring that what we we're able to do is it's 120 new positions over a 3-year period over the next 3 years. And as of September 25th, There's been a total of 29 new practitioners been hired, 16 that are ministry staff, and 13 through contracts.
Member.
Thank you, Chair. And does the minister know how those are all distributed province-wide? Or you can get me that information later.
Yeah, Minister.
We'll get that information for the member.
Member.
Thank you, Chair. So according to, and I've canvassed obviously similar questions to the new Minister of Mental Health and Addictions, and I know that there is a genuine commitment to having seamless care, and I've heard the whole government approach and the strategies and integration and the correlation and coordination. Will child and youth mental health then remain in MCFD, or will it be moved to that new ministry or health? And if it's going to stay in MCFD, how will that seamless care be handled with your with the MCFD, health, mental health and addictions, and I'll throw in education as well?
Minister.
Thank you, Mr. Chair. So the ministry is working collaboratively with other ministries, and across the board from all levels of the different ministries are working together to ensure that we have the best services possible, and within the ministries. We also are, so that's already happening, that's already being coordinated. Also, we know we need to improve services for children and youth with mental health issues. And to that end, not only are we seeing the collaboration with all the ministries, but we also have a mental health and addictions working group at the cabinet level that the Premier has asked us to work towards, looking to ensure that we are making sure that the services are going to be, like, we're committed to making sure that we're going to have those services in place. Ultimately, as far as organizational structures, those decisions will be coming from the Premier's office, and we know that he'll be committed to ensuring that it's done in the best way to provide the most services, the best form of services for children and youth in this province when it comes to mental health. And I think his commitment to it is there because of his creating a whole ministry that's committed to ensuring that this work is done.
Member.
Thank you, Chair, and thank you for that. So, again, getting back on the seamless and the coordinated and the collaboration, how will the services provided by nonprofits paid for by MCFD be seamless services between health, the new ministry, MCFD, education, and whatever other ministries might be coordinated or responsible with the nonprofits? Just trying to get on how this seamlessness is going to be maintained.
Minister.
Thank you, Chair. If the member is asking about contracts, the ministry, they set the standard. We set the standard for those contracts, and the ministry will manage those contracts and to ensure that there is a seamless system of delivery of services for mental health in the province.
Thank you for that. I now have a question specific to my area. Why is there a difference between assessing child and youth mental health services with Vancouver Coastal Health and MCFD? There's a difference between accessing services if you live in the North Shore or if you live in Richmond or Vancouver.
Minister for Children and Family Development.
Thank you, Chair. Okay, just so I get this all right, the ministry contracts, no, just a second, no, in a couple of service development areas, the ministry contracts with local health authorities for some of the child and youth mental health services, but in all cases they're required to use the same standards and policies. So if the member has an issue that she'd like to follow up on, we'd be happy to follow up on her with it.
Member.
Thank you, Chair. Yes, that would be very helpful. So I'll give you more details, or give the minister more details, because there seems to be differences on what you would think were the same services, and obviously the same health authority, but because of how they're delivered, the services are different on the North Shore than they are in Richmond and Vancouver. So I will get those details. And then just, I know that you have, or there's another minister that is coming. Just another question about the North Shore. Why is it that the Parents in Residence program is not allowed to be on the North Shore, but is allowed to be in Vancouver and Richmond when they're all funded by MCFD?
Minister.
Thank you, Mr. Chair. So the ministry funds Family Smart to deliver the parents and residence programs across BC, but we don't have the specific details to the areas you're talking about, so we're going to follow up on that for the member.
Member.
Okay, I really appreciate that. And I've got more questions, but I understand there's going to be a switch in ministers. So I will come back tomorrow, and my colleague here will take over. Thank you, Chair.